Assalamu alaikum. My seminar today will be about the brain cisterns, CSF flow, and meninges. So starting with the subarachnoid cisterns, they are a deep subarachnoid spaces within the brain. They contain CSF more than the ventricles itself, and they also transmit cranial nerves and intracranial vessels. There are many brain cisterns, but we will talk about the most notable ones. Starting with the cisterna magna or the cerebellomedullary cistern. So the location of the cisterna magna, it lies behind the medulla and below the cerebellar hemispheres. It receives the CSF from the fourth ventricle via the median aperture, the foramen of Magendie, and then continue downward to the spinal subarachnoid space. Here is the MRI image of the cisterna magna. As you can see here, it lies between the medulla and below the cerebellar hemisphere. The content, it contains on its lateral part, the vertebral artery, and it is posterior inferior cerebellar branch or the pica, also the glossopharyngeal vagus and accessory nerve. Next is the Pontine cistern. The Pontine cistern or the pre-Pontine cistern, the location, it lies between the pons and the clivus. It is continuous with the downward, also with the spinal subarachnoid space, and above with the interpedicular cistern. It receives the CSF from the fourth ventricle via the lateral aperture of the fourth ventricle, the two foramen of Luschka. The content, the Pontine cistern contains the basilar artery and its pontine and labyrinthine branch, also the abducens cranial nerve. Here's the MRI image. You can see here the Pontine cistern between the pons and the clivus. And here's the axial image. Next is the interpedicular cistern. Interpedicular cistern, from the name, it lies between the cerebral peduncles and the dorsum celli. And it is continue, here it's more the axial image. Here's the midbrain and the two cerebral peduncles. So it lies between the cerebral peduncle. And it also continue below with the Pontine cistern and laterally with the Ambient cistern, as you can see here, and superiorly with the Supracellular cistern. The content, this interpedicular cistern contains the posterior part of the circle of Wallace. Next is the quadrigeminal cistern, and also from the name, the quadrigeminal cistern, it lies behind the quadrigeminal plate of the midbrain or the tectum, and below the splenium of the corpus callosum and the vermis of the cerebellum. The quadrigeminal cistern, it contains the venous confluence of the internal cerebral veins and the basal veins to form the great cerebral vein of Galen, which unites with the inferior sagittal sinus to form the straight sinus. So here's the MRI image behind the quadrigeminal plate of the midbrain. Here's the quadrigeminal cistern, and this is the axial image. Next is the cistern of the velum interpostum. So this is the velum interpostum, which is a potential space, lies between the layers of the telacordi of the third ventricle. It passes, as you can see here, beneath the splenium of the corpus callosum and the fornix. And if this cistern is filled with CSF, then it's called the cistern or the cavum of the velum interpostum. On axial image, as you can see here, it has a triangular shape. The content, this cistern contains the internal cerebral veins. Next is the ambient cistern. The ambient cistern, they are located around around the midbrain. And it's continue posteriorly with the interpedicular cistern and superiorly with the supracellular cistern. The content, this cistern contains the posterior cerebral artery and the basal vein, and both lie in the anterior part, of the ambient cistern. Next is the supracellular cistern, and as the name suggests, it lies above the pituitary fossa between the anterior part of the floor of the third ventricle and the diaphragm silly. And the content, this cistern contains the anterior part of the circle of Willis. Here's the MRI image of the supracellular cistern. So the previous cistern, altogether called the basal cistern or the perimesencephalic cistern. As you can see here in this schematic diagram, here is the midbrain, and in between is the interpedicular cistern. Laterally is the ambient cistern, posteriorly is the quadrigeminal cistern, and superiorly is the supracellular cistern. And in another slice, we will see the Pontine cistern. And here's the MRI image: interpedicular cistern, crural cistern, ambient cistern, and the quadrigeminal cistern. The pericallosal cistern. So as here we said that the supracellular cistern above the pituitary fossa, it continues as the cistern of lamina terminalis, and then as the pericallosal cistern, which continue posteriorly to the quadrigeminal cistern. This cistern contains the branches of the anterior cerebral artery. And here is the MRI image of the pericallosal cistern. The cerebello-pontine angle. Cerebello-pontine angle cistern is a subarachnoid space within the posterior cranial fossa. It lies between the anterior surface of the cerebellum and the lateral surface of the pons, as you can see here. About 6 to 10% of all intracranial masses are found within this location. Vestibular schwannoma are the most commonly found, followed by meningioma. The content of this cistern, the facial nerve, vestibulocochlear nerve, folliculus of the cerebellum, foramen lusca of the fourth ventricle, and the anterior inferior cerebellar artery. So, and here's the summary of all brain cisterns, starting with the cisterna magna, then the medullary cistern, the pontine or pre-pontine cistern, interpedicular cistern, then the chiasmatic cistern, cisterna of lamina terminalis, pericallosal cistern, and finally the quadrigeminal cistern. So what are the clinical implications or the clinical relevance of these cisterns? First, they provide a surgical approach to the intracranial vessels and nerves for the treatment of aneurysm, AV malformation, and for surgery of basal tumors. Also, certain cisterns have a clinical relevance for potential herniation syndromes, layering of subarachnoid blood, or the significant structure that runs through them. Also, opening of basal cisterna for evacuation of CSF is a well-recognized and effective method for brain relaxation and microneurosurgical approaches to the skull base, especially in microvascular surgery. So here, how to evaluate the brain cistern. We look for presence of blood, symmetry, and effacement. As you can see here on the left, this is the quadrigeminal cistern having the smile sign, which is normal. And here on the right, you can see that the cistern is compressed and effaced due to cerebral edema. Also, this is the supracellular cistern, which have normally a star-shaped appearance. But on the right, we note the asymmetry due to compression and effacement of the cistern. Also, another example, subarachnoid hemorrhage, you can see that blood within the supracellular cistern, the ambient cistern, and also the Celvian cistern. Here is the normal quadrigeminal cistern, as we said, the smile sign. But here is with elevated intracranial pressure, the cistern is effaced. And this is also an example of the absence of the cisterna magna, as you can see, which is filled by herniated cerebellar tonsil, causing compression on the brainstem. And here is after post-op. You can see now the cisterna magna is clear. And here's an overview of the CSF spaces. So normally, all the CSF spaces, including the ventricle and cistern, should be visible. In case of a brain atrophy, both the ventricle and cisterns will be dilated. In case of hydrocephalus, the ventricles will be dilated, but the brain cisterns will be effaced. And in case of a brain edema, all these spaces will be effaced. Okay, and that was the end for brain cistern. Now we'll talk about the CSF flow. So the total volume of CSF is about 150 ml. 25 ml is within and around the spinal cord, and the rate of production is 0.4 ml per minute. The CSF is produced by the choroid plexus of all ventricles, but mainly the lateral ventricle. So here is a schematic diagram of the CSF, or the pathway of CSF flow. So start with the CSF is produced and secreted by the choroid plexus of each lateral ventricle, and then through the foramen of Monro, or the interventricular foramen, from the lateral ventricle into the third ventricle. Then the choroid plexus of the third ventricle will also add CSF, which will flow to the fourth ventricle via the cerebral aqueduct of Sylvius. And also the choroid plexus of the fourth ventricle will add more CSF, and then the CSF will flow through the 2 lateral apertures and 1 median aperture. Then the CSF will fill the subarachnoid spaces of the brain and spinal cord. Then at the arachnoid villi, CSF is resorbed into the venous blood of the dural venous sinuses. So we have what's called arachnoid granulation. They are projections of the subarachnoid membrane villi into the dural venous sinuses that allow the CSF to pass from the subarachnoid spaces into the venous system. They are most commonly found within the transverse and superior sagittal sinus. These arachnoid granulation typically have CSF density and protrude into the calvaria or dural venous sinuses, causing a filling defect. They may stimulate a dural venous sinus thrombosis, but usually easily differentiated given their round, well-defined shape and a classic location. So here's an example. You can see this CT brain show here a filling defect in the right transverse sinus. And this is also the MRI image showing a giant arachnoid granulation. We have a technique, MRI CSF flow study, a technique using cardiac gated gradient echo phase contrast MRI image to show the CSF flow. It can also be used to demonstrate the direction of CSF flow and distinguishing arachnoid cyst from open CSF space. It's also possible to calculate the CSF flow velocity in any location. The final topic is the meninges. Meninges are thin layers of tissue found within the brain. They are covering the brain and spinal cord. We have 3 layers, the dura mater, arachnoid, and pia mater. The dura mater and arachnoid are both anatomical units, and only separated by pathological process. So the outer layer is the dura mater. It is the tough outermost, which is closely adherent to the inner table of the skull. Then the arachnoid mater. It is a thin layer closely applied to the dura mater. Then we have the subarachnoid space, which is a space between the arachnoid and the pia mater, contains delicate trabeculated connective tissue and CSF, and also vessels. And then the pia mater, which is a very thin layer applied to the surface of the brain. The clinical significance of meninges, knowledge of the anatomy of meninges is essential for understanding the CT appearance of intracranial bleeding. The dura is hyper-intense on CT images and relatively hyper-intense on MRI. It shows contrast enhancement on both modalities. The dura unfoldings We have, there are layers of dura. We have first is the falx cerebri, which is the largest. It is sickle in shape, and it forms incomplete separation between the two cerebral hemispheres. It extends from the crista galli to the internal occipital protuberance, where it joins the tentorium cerebelli. It contains two venous sinuses. The superior sagittal sinus runs above the upper fixed margin, and the inferior sagittal sinus, which runs along the free border. The fault is demonstrated as midline linear density on axial CT scan near the vertex, but inferiorly and posteriorly assume a triangular shape, confirming the superior sagittal sinus. And here you can see that. Okay, and next is the tentorium cerebelli, and the second largest dural fold after the falx. It divides the cranial cavity into tentorial and infratentorial compartment. It has a free and attached margin. It's attached from the posterior clinoid process along the petrous ridge to the internal occipital protuberance. It is upper free medial border surround the midbrain. So the clinical significance of dural unfoldings, pathological processes may cause mass effect with deviation of the falx towards one side. In case of subarachnoid hemorrhage or subdural hematoma, the tent may become more dense due to the layering of blood. Also meningiomas and benign intracranial tumors, which may arise from any part of meninges, including the falx or tentorium. And that was the end of my seminar. Thank you for your attention. شكرا.
شكرا جزيلا دكتورة نور، عاشت ايدك. بس نعطينا مجال، خاف واحد عنده سؤال قبل ما نروح على لي. واحد عنده سؤال حول المنينجيز والCSF سبيسز؟ ماكو. إذا نروح على الأسئلة، بس هذه عندك أسئلة؟ دكتورة نور.
نعم أستاذ. ما سمعت، خف قطع النت. حلو.
بس هاي عندك الأسئلة؟
إيه بس هاي أستاذ.
أوكي. إذا نروح على محمد. Question number 1. The cistern magna lies between the bones and. تسمعني محمد؟
العفو أستاذ، أنت محمد مهدي؟
إيه.
نعم. The cistern magna lies between the bones and the posterior inferior surface of the cerebellum. False. Not the bones, the medulla oblongata. Between the medulla oblongata and the posterior inferior surface of the cerebellum.
Okay. الروح العقيل. عقيل فلاح. Number 2.
نعم. The cisterna magna continues below with the spinal subarachnoid space. True.
Okay. نروح إلى دكتورة كازان.
نعم أستاذ. The cisterna magna contains the vertebral posterior inferior cerebellar artery through its lateral part. It's true.
True. Number 4 دعاء. دكتورة دعاء سعد.
The basilar artery lies in the Pontine cisterna. True.
True. شنو التسمية الثانية البونتاين؟
Pontine cisterna.
Excellent. أما Pontine أو Pontine sister. نروح الدكتورة مريم. Number 5.
نعم دكتور. The ambient cistern surround the midbrain and transmits the posterior cerebral and superior cerebellar arteries. Job true.
True. The ambient surrounds the midbrain and transmits the posterior cerebral and superior cerebellum. أستاذ محمد تكمل. وصلنا نمبر 6.
عن أستاذ رعد.
نمبر 6 وصلنا، تفضل.
عمر موجود؟
نعم أستاذ. Number 6.
Number 6 نعم.
The supracellular cistern contain the circle of cells. True.
نعم جيد. لارا نصير. Number 7.
نعم دكتور. The velum interpositium is the cisternal space above the fornix. Falls below the fornix.
Below the fornix. زهراء صباح. Number 8. زهراء موجودة. أحمد خليل. Number 8.
نعم أستاذ. Cistern of a great cerebral vein is a quadrigeminal cistern. It's true. The great cerebral vein or vein of Galen located below the splenium. وهي ال quadrigeminal cistern here.
هبة. Number 9. هبة عماد.
نعم أستاذ.
آخر وحدة.
Number 9. Causal artery runs in the cistern of the lamina terminals. False. Causal cistern.
جيد.
عاشتي لك دكتورة نورة محمد جواد.